Hey everybody, it's Dr. G again, and this time we are going to be covering a case of invasive cervical resorption on CBCT. So, exactly what is invasive cervical resorption? I get asked this a lot actually. It is a variant of external resorption that begins at the cervical junction and extends throughout the dentin and around the pulp chamber in the root canal. It's actually really interesting because it's going to actually leave a thin layer of dentin protecting the pulp chamber and the root canal until the very final stages. So, on this case, it's a sagittal view, CBCT, and I'm scrolling through a maxillary molar here, and the first thing we're going to come across is the external resorption. You can see it right at that cervical junction going into the dentin on this tooth. And as I continue scrolling through, you'll see these radiolucent areas where the resorption is occurring, and you'll also see that the pulp chamber is intact and that the resorption has not broken through to this area on this tooth. So we're going to just keep on scrolling through until we get to the end of the tooth here. Okay, so now I have just a screenshot of the axial, coronal, and sagittal views showing you this external resorption. And I want you to look on the top left, the axial view. Got an arrow pointing to that thin layer where the resorption is not continuous with the pulp chamber, which is really interesting. And that's the short and sweetness of this. Thanks and enjoy. If you like it, please subscribe below. And I also have a link below to another case of invasive cervical resorption as seen on 2D. Thanks and enjoy. Bye.